My name is Sabrina Gibson, Sabrina Gibson, and now I'm going to scope of the room. My patient with his script. And here I have my vital signs on a piece of paper. Okay, and we're going to get ready to start. Okay, hi there, how are you?
Good, how are you doing?
Good, my name's Sabrina. I'm going to be your nurse for today.
Okay.
I'm just going to do a couple assessments on you. Is this okay?
Yep.
Perfect. I would normally perform the PQRST. Can I just have you slide over a little bit, please? Thank you. The PQRST at this point. Now it's done. I'm just going to assess the patient's vital signs. I have heart rate 105 beats per minute, which is a little tachycardic. Regular heartbeat. Rest rates are 20. A little on the high side, but still within normal range. Blood pressure, he has high blood pressure, 167 over 100. Temperature is 37, which is a normal range. Okay. I'm just going to ask you a few questions, if that's okay with you.
Sure.
So, have you been having any chest pain?
I have like an ache in my upper chest.
Okay, any abdomen pain?
Yeah, that's what I'm here for. I have a stomach ache, I guess. Right in the middle, it hurts.
Okay, have you had any palpitations, irregular heartbeats in your chest?
No, I don't think so, no.
Any cardiac history in your family, or any surgery or any heart problems?
Well, I take a pill because my cholesterol's high, and so is my blood pressure.
Okay, have you had any shortness of breath at all?
No, my
No.
breathing's been okay. I don't think that.
Any swelling in your body or your legs and your feet?
No, no swelling.
No, none of that. Any
No.
nausea or vomiting?
Oh yeah, I'm nauseous right now, and I already vomited once on the way here.
Oh, can you tell me when your last bowel movement was?
I mean this morning normal.
Do you drink any alcohol by any chance?
Not a lot, like a glass of wine here and there with dinner. That's it.
Okay, I'm just gonna start with a couple assessments. Okay, first I'm just gonna have you sit up and raise your shirt if you can for me. I'm just gonna take a look at the chest. I see no work of breathing. Chest is rising symmetrically. I see no scars or signs of striae. None of that. Okay, I'm just gonna palpate and just have a quick feel. Skin temperature feels good. I see no signs of swelling or edema. Now I'm just gonna palpate the pulses. I'm gonna palpate the radial pulses. Regular and strong, +2. Carotid I would palpate separately. Strong and good. I'm gonna palpate the brachial arteries. And then the pedal. Perfect. Everything's strong and good. No signs of edema. Okay, and I'm just going to take a look and a quick listen. Okay, I'd listen in the right second intercostal space for the aortic. The second intercostal space for the pulmonic. On the left, third intercostal space on the left is herbs. Fourth intercostal space on the left is tricuspid. And the fifth intercostal space at mid-clavicular line is the apical. And that's where I'd listen for 1 full minute if I found any irregularities in the heartbeat. I do hear S1, S2 sounds, which sound great. If I heard any murmurs, which sound like S3, S4, I would auscultate with the bell of the stethoscope. Everything checks out and sounds good. I'm just going to have you lay down for me quickly, and I'm going to inspect your abdomen. Okay, I'm going to inspect it. It's flat, a little bit rounded, hairs evenly distributed, umbilicus in the right place. I don't see any aortic abdomen pulses. I'm just going to auscultate in these quadrants, listen for bowel sounds. I start in the right lower quadrant. And here's where you'd have the appendix. And I start or then up to the right upper quadrant. And this is where you would have your gallbladder and your liver. The left upper quadrant is where your stomach and your spleen. And the left lower quadrant is where you'd find your descending colon. I hear bowel sounds in all 4 quadrants, which is great. Perfect. If I didn't hear any bowel sounds, I'd listen for a full 5 minutes to make sure bowel sounds are all present and active. Okay, and I would palpate last, and I would palpate the painful side or quadrant last. So first I'm going to start with the percussion. And over the organs, I would hear a dull sound. Over the rest, I would hear a nice flat. Everything checks out great. Now I'm just going to auscultate. I would auscultate last so I don't disrupt the bowel sounds inside. I would palpate last so I don't disrupt the bowel sounds inside. I'd palpate with 2 to 3 fingers. I don't feel any bumps. Don't see any bruises. Okay, everything checks out great. I would call the doctor and perform my S-bar. Hi doctor, this is Sabrina Gibson calling. I have a 63-year-old female patient in the ER. She is presenting with abdo pain, about an 8 out of 10, as well as chest pain, 5 out of 10. She's had no shortness of breath, but she's had nausea and vomiting. She has a cardiac history, high blood pressure. Vital signs, she's kind of on the high side. High blood pressure, rests are on the high side. I'd recommend assessment from a doctor if possible. And what I'm thinking with this patient is she could possibly be having angina or MI. I would put her in high Fowler's position and apply 2 liters of oxygen. I would expect the doctor to order ECG, tropes, and nitro as well.